I was going out about 7 in the morning to go have breakfast with my breakfast buddies because I was getting in my car, and just all of a sudden, my vision got wobbly, and I didn't know what was wrong, but I knew it was something serious. So I knew I needed to make it back in the house. So I got back in there, hollered for my wife, and so we called 911. When they got there, they were doing some triage, and I'm kind of like just about going. I said, I need to go to Rex. That's where my records, my physicians are at. And my wife said, well, he's had an aneurysm for about 5 years, been tracking. When she said that, load him in the truck. So they whipped me right in, got a CT scan. They got me in surgery. That was Monday morning, and I didn't wake up until late afternoon, Tuesday.
So an aortic aneurysm is more or less an outpouching of the aorta, and it's sort of like a balloon, right? So as the pressure increases and this outpouching happens, then you develop this type of aneurysm, and as it gets larger, the risk of rupture increases.
In my viewpoint, is that it's really a team-based effort. You need an orchestra to be able to conduct this sort of case smoothly and appropriately. So it all starts from the emergency room physician, and from there getting assessed properly. And I think Ricky was definitely in the right place at the right time.
I must admit, it's the most stressful call that we get. I never had a chance to talk to him ahead of time. I talked to his wife. I told her that this is a very critical operation that we just have to go do fast. Once we replaced the distal portion of his aorta, we're able to put a cross clamp back on and essentially just replace his entire ascending aorta with an artificial tube graft. All in all, the operation took around 4 or 5 hours. And so the 21 minutes is specifically the circle rest time. The longer that circle rest time is, again, the more chances of neurologic deficits. And he woke up beautifully. And so really no neurologic damage whatsoever, which is outstanding.
When Hazel called me, she said what Dr. Reade had to do, says one of the worst tears he's ever repaired, and the patient survived. She said, you had about a 5% chance of survival. She said, we get about 3 patients like you every year. So I had a football jersey made up with the number 21, his name on it and everything.
The team that we have here at Rex is extraordinary. And when I say that, it's the diversity of options that you have.
That's one of the nice things at Rex here, especially amongst our 4 cardiac surgeons, is that we help each other out a lot, and we're not looking to one-up each other in any way whatsoever. I mean, it's all about patient outcome first.
Some of the things that stood out, to me, that's a positive differentiator of the Rex team, is that you can take employees sometimes and look at them as made up of 2 parts, their skills and their personal values. You know, I can teach somebody how to measure blood pressure, we can teach somebody how to do a surgical procedure, but you can't teach people to care. And what I've seen here with the Rex team, they have that sense of caring. I just want to close out by saying, with all the Rex team, love you all.